السلام عليكم.
وعليكم السلام ورحمة الله وبركاته.
محمد.
أنا فيصل.
محمود، مساء الخير، كيف
الحمد لله على
طيب؟
السلامة، مساء النور،
الله
الله
يسلمك،
يسلمك.
كيف الحال؟ طيب.
الحمد لله بخير، الحمد لله.
الحمد لله، الله يعطيك العافية إن شاء الله.
الله يبارك فيك.
Ta- Take a look. I prepared few slides. See, window بس. Anything appeared?
بدأ يظهر.
ظهر؟
ظهر.
ممتاز. Basically, we will have. I will stop sharing until we start. There will be Dr. محمد عبد المعطي، دكتور محمد رضا، ودكتور حاج بدأ. So as we discussed.
حد من الكانديديتس موجودين، أو حد من الزملاء الانترستد في الحضور موجودين؟ عشان بس أنا شايف أسامي جديدة. دكتور خليل.
I'm here.
أهلا دكتور خليل، السلام عليكم.
أهلا بكم. السلام ورحمة الله، إن شاء الله أموركم بخير. دكتور خليل، أخصائي أول جراحة تبوك، حاليا في الجزائر.
دكتور خليل.
الحمد
دكتور
لله.
خليل، مساء الخير، وشرك صباح.
أهلا دكتور
الله
خليل.
يسلمك.
دكتور منور. دكتور خليل. دكتور عبد الفتاح. معانا دكتور عبد الفتاح. طيب دكتورة ليندا. دكتورة ليندا. ودكتورة علا طاهر. علا.
السلام عليكم.
أولاد.
دكتور عبد الفتاح.
وعليكم السلام ورحمة الله وبركاته. دكتور عبد الفتاح.
يا هلا بحضرتك، الله يخليك.
أهلا دكتور عبد الفتاح.
يا اهلا بيك.
نتشرف بيك.
الله يكرمك، الله يخليك. انا دكتور عبد الفتاح، سينيور ريجسترال في مستشفى السلامة في جدة.
أهلا وسهلا. أهلا دكتور عبد الفتاح.
اهلا بحضرتك، الله يخليك.
مرحبا بك.
تمام. وفي دكتور أرسل رسالة، دكتور إبراهيم أعتقد. شفت رسالة أنا. دكتور إبراهيم دمور. سوري مايك not working. No problem دكتور إبراهيم. ويلكم دكتور إبراهيم. تمام. طبعا دكتور حاج. أظن ده الدكتور حاج بتاعنا.
دكتور حاج بتاعنا.
دكتور حاج أو دكتور حاج. He's one of us now.
ازيك يا دكتور محمود بالمصرية؟
الحمد لله. أهلا أهلا أهلا.
دكتور حاج. دكتور حاج،
كيفك؟
الحمد لله دكتور حاج، كيفك أنت؟ أخبارك؟
الحمد لله. اشتقنا لك دكتور محمود.
very much fine.
دكتور شايب كيف؟
حبيبي الله يعطيك العافية.
دكتور حاج، السلام عليكم، مساء الخير.
وكل الجماعة
صباح
بخير الحمد لله. كيفك؟
الحمد لله.
لاباس
الحمد لله.
يا اخوي، اشتقناكم يا اخويا. دكتور ايهاب، دكتور ماني، دكتور عادل،
الصحة
كلكم. دكتور هيفا، كيفكم؟ دكتور عبد الفتاح حبيبي موجود هنا.
ازيك؟
ازيك دكتور عبد الفتاح؟ كويس
الله يخليك.
الحمد لله.
طيب I can see many participants here. دكتور عبد الله ماهر، دكتور عبد الفتاح اوريدي تعرفنا عليه، دكتور أنس، أبو ساتي، الدكتور باسم طبعا one of the faculty، دكتور حاج our friend، دكتور إبراهيم already sent on chat، ودكتور احتشام دكتور احتشام الحق. ويلكم دكتور احتشام. دكتور ليندا كارا، هاو ار يو دكتور ليندا. دكتور محمد زيدان، دكتور علا طاهر عبد القادر، ودكتور سقيب الرحمن.
Dr. Faisal, I believe we can start.
دكتور إيهاب السلام عليكم. I'm waiting for you.
I'm here. I'm waiting for you to start.
دكتور إيهاب
I believe we can.
دكتور إيهاب
I'd like to welcome everyone, and we can give another 2 or 3 minutes. I'm seeing a lot of candidates starting to join. Then we can start. Dr. Mahmoud Kakan. يعني within 2 minutes we will start.
In 2 minutes we will start.
Yes, exactly. Because it is 2:04 now. Our timing is 2. We can 2 or 3 minutes. We can start.
Yes. I'm seeing a lot of other people trying to
still joining.
Trying to join. دكتور حاج مبروك يا دكتور حاج. ألف مبروك. لقيت وظيفة ولا لسه؟ ولا أنت اوريدي هنا؟ Your mic is muted يا حاج.
Your mic is muted دكتور حاج. هو هنا أعتقد already.
Your mic is muted.
Your mic is muted.
كده يبقى أنت مش هتلاقي وظيفة.
I think he's already here.
ايوه كده المايك.
كيفك
اخبار الشغل ايه؟
استاذ فاضل كيفك؟
عملت ايه في
لا انا خلاص انا شغال.
عملت ابجريدنج يعني وجبت اللايسنس بتاع وزاره الصحه ولا لسه؟
ايوه لا خلاص انا شغال.
ما شاء الله. انت قلت انت كنت فين؟ في حفل الباطن باين ولا فين؟
لا انا تبرجل.
الف مبروك.
تبرجل الجو.
مبروك عليك دكتور زرقاوي، مبروك عليك.
كيفك خالد؟
الحمد لله مبروك عليك، نشوفك بخير ان شاء الله. اكرم ان شاء الله. ان شاء الله. شكرا.
طيب دكتور فيصل I believe we can start بقى دلوقتي.
We can start.
شكرا.
طيب
السلام عليكم.
ممكن اقدمك يا دكتور فيصل؟ يعني يشرفني اقدمك. انت اللي هتقدم الناس فانا هقدمك.
الله يعطيك العافيه.
السلام عليكم. Good afternoon or our colleagues and the attendants. This is the session preparatory or orientation session for that prepared or organized by PrepMedico for the course of general surgery consultant license exam or interview preparation in Saudi Arabia. We'll start by Dr. Faisal Shaib Al-Dor. He is a general surgery consultant in Saudi Arabia. He is assistant professor of general hepatobiliary and colorectal surgery in Algeria. Welcome, Dr. Faisal, and the mic is yours.
Thank you, Dr. Mahmoud. Assalamu alaikum. Good afternoon, everyone. We are pleased to have all of you today between us. Thank you for your precious time. Thank you for attending for this third webinar of the PrepMedico Scfhs group in the preparation of our third course, inshallah, starting on September 5th, inshallah. So on behalf of the PrepMedico group, I would like to warmly welcome you to all today's webinar. We are very pleased to have you join us as part of our continuous journey to support surgeons preparing these international pathways. PrepMedico is dedicated to advancing surgical education across different systems. The main group is located in UK, and the main purpose is to prepare the candidates to the MRCS and the FRCS exam. And alhamdulillah, this year we could start in Saudi Arabia, the preparation of the Saudi Commission for Health Specialty General Surgery Consultant Interview Exam. We already underwent 2 sessions, 2 courses with excellent results, with index of success of 100% until now, alhamdulillah, for the first attempt. You can visit our website. You will find all the data that you need, the feedback of the previous candidates, the previous recorded webinars. And today we will try together to understand the whole exam, the whole system, and how the course will run, inshallah. So we are pleased to welcome our esteemed faculty, Dr. Basim Sharif. So he's a general surgeon, consultant, traumatologist, examiners, member of Saudi Commission, and he's, if I'm not wrong, Dr. Basim will correct for me, the program director of General Surgery Board West region in Saudi Arabia. So we are pleased to have Dr. Basim with us. Also, we welcome Dr. Ihab. Dr. Ihab Saad is Egyptian general surgery consultant, colorectal consultant, head of department general surgery in the group Saudi Almani Hospital Group in Jeddah. Also, we are pleased to welcome my friend Dr. Mahmoud Talat, hepatobiliary surgeon, Egyptian general surgery consultant, one of the very active member in between all the team. Dr. Basim, the floor is yours. So we will try together to do a review together. Dr. Basim will introduce the course and the exam. Then we are blessed also to have 3 of our previous candidates, Dr. Muhammad Rida, Dr. Haj Adda, and Dr. Muhammad Abdul Mu'ti, recently passed their exams, and all of us, there was attendees of our courses. Then we will try, if we will have enough time, to do some simulation of the exam through 2 or 3 cases. Then Dr. Mahmoud Talat will conclude with tips and tricks for the exam and conclusion and the session of questions and discussion. Dr. Basim, the floor is yours.
السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. اللهم أرنا الحق حقا وارزقنا اتباعه وأرنا الباطل باطلا وارزقنا اجتنابه. It is an honor and pleasure for me to join you, everybody. It's really thrilling to see how much the applicants or the attendee today. When we did our last course, I think we were like not even half of this number. So I'm really pleased that we are progressing well in PrepMedico, and I'm sure everybody today will feel the difference between the last course and this upcoming course, inshallah. In PrepMedico, actually, I was maybe the latest to join the group, and I'm really thrilled with everybody in the group, with all the consultants, the organizers, and the faculties. Our aim in PrepMedico to prepare everyone to pass their exam in Saudi Commission for Health Specialties. As the Saudi Commission for Health Specialty board member and director of general surgery residency program in the Western region, I can tell you it's not that difficult. It's just like a matter of organization, a matter of arranging your thought, a matter of approach. And this is what they do in PrepMedico. In the last course, from the lectures I attended, we try always to focus on the exam orientation, because all of you guys are senior people. I'm sure we will not add more knowledge to your already existing knowledge, but maybe we will just try to rearrange things and go through the hot seat with you, so you are more familiar when the exam comes. Just to declare, I'm not part of the committees who do these exams. I do exams for other candidates and other type of trainee, but I'm not part of the exam committee who do the consultant interviews. This is just for declaration. But from my experience, it's not far different from other specialties or sorry, other types of trainees. The exam usually it's just an oral exam, and they go through scenarios more or less. In PrepMedico, basically, the arrangement will be each faculty of us will do a day of lectures, of interactive lectures, and I see the more you prepare for the topic, the better outcome of these lectures will be. So if it's not one-to-one, sorry, it's not one-way lecture, it's more of a discussion, because if you have a point, if you have something not clear, if you have a scenario in your mind, or even if you have a case you encountered in your daily practice, we can discuss it, because the exam will be part of the daily practice exam. Sorry, the daily practice patients. The committees in Saudi Commission, they just want to make sure that you are a safe consultant. You know your limitation, you know when to go back for a senior member when you make a correct decision. So this is what we try to do. So one day lectures, one day Viva exams, where we go through real life scenarios. And sometimes we do it one-to-one, sometimes we do it as a group. For the timing, we are flexible in timing of these lectures, but we appreciate and we understand that most of us has busy schedule, so we try to make it in your free time and other faculties free time. If somebody of the candidates have a set date for the exam, I'm sure everybody will be very willing to give them an extra session and an extra Viva exam during their preparation outside the scheduled timing. Other than that, as I mentioned, like, we are not here to add knowledge to your already existing knowledge. We are here to help you to sharpen this knowledge and to pass the exams, inshallah. Thank you.
Thank you, Dr. Basim. Thank you very much for this precise introduction. From our previous candidates, I think we have Dr. Haj Adda, we have Dr. Muhammad Rida. Can you hear me?
Yes, Faisal.
Dr. Muhammad, Assalamu alaikum. How are you?
كيف الأحوال؟
So we will introduce Dr. Muhammad Rida. He is associate professor in Algeria. He is a newly licensed general surgery consultant in Saudi Arabia. I passed the exam recently. So if you can tell us about your experience.
Yes, I would like to share my personal experience with the PrepMedico online training and the big team of consultant surgeons who are dedicated to training candidates preparing for the consulting classification exam in general surgery in Saudi Arabia. This program has truly and really transformed my preparation. I was start my preparation from the month of January, and I begin the preparation with the PrepMedico in May month. May, I think, or June.
Sorry?
In June, in the month of
Yes,
June.
yes. You started in by the end of June.
By the end of June, exactly.
By the end of June.
And this program has really transformed my preparation, and this training helped me a lot, more than I expected. First, it helped me to organize my knowledge. Before, sometimes I feel confused or nervous when I respond, when I approach the clinic case, sometimes lost and I don't know where to start anymore. But after the course, I knew how to answer the question clearly and in a good order with the structured response. This made me feel more confident during the exam. There is very important because there is stress, there is strange. If I can explain strange experience for us as an Algerian surgeon, we have not experience in oral exam, and after this formation, this course, I feel very more confident during the exam. The course also teach me to always think about the patient safety. This is very important in surgery. I learned that being a good surgeon is not only about knowledge, but also about caring of the patient and working safely. It's very important, and I have this notion, this formation in this preparation, and it was very important in the exam. I also learned about my limits as a doctor. It's important to know when to ask for help or advice. It's very important. The course helped me understand how to work well with my colleagues and communicate better with all of the team. Finally, if you want to pass the consultant exam for Saudi Arabia, I really recommend PrepMedico. It's a great way to prepare, build your confidence, and improve your skills. Following this training helped me a lot, and I believe it can help you too. Voila, it's all for me.
Thank you very much, Dr. Mohammed. Just three questions. As we discussed before in our previous webinars, to success the exam, in fact, there is three keys. You need to have a minimum of level of English, you need to have knowledge, and you need to have an extensive training. Dr. Mohammed, what do you think by the end of your training? What about your medical English and the possibility to answer? How you rate it if you compare before and after?
Before the preparation, I understand English, but I have very difficult to explain. We have not an entourage to explain English daily. But after this preparation and after this Viva, after Viva and interactive course and interactive clinic case, I improve my English. I improve my English a lot of with practice, a lot of practice with the consultant surgeon.
Absolutely, we clearly observe that for most of our candidates, because in fact the trick in the training, every day and every week, you have you have one lecture and one mock Viva, and
Exactly.
this will create an environment to try to speak. And it's not a matter about to speak clear English as US or UK citizen. It's about medical English. About the knowledge, I believe, as Dr. Basim said, all of us have all the minimum knowledge to have the exam. But the question is how to organize. And this is my second question. How you feel about the knowledge before and after?
Knowledge, as you know, we have knowledge. We have already read. We have internet to update knowledge, but our knowledge. But how to answer, how to structure the response, how to be clear, how to give the most important idea, how to organize your response. It's very important. I have not this way to structure my response, but after after this formation, this preparation, this course with our colleague, I perform this competence.
And my third question, what about the self-confidence? Because the third key is the training. And one of our purposes to push every candidate in each session to speak and express himself. And the final purpose is to make him confident when he answers. And now how to manage safely the patient. About the self-confidence, how you feel, how did you feel before and after?
كما يقولوا بالعربي الكونفيدنت شغل تحصيل حاصل. لما نكون عندنا الستركتورد ريسبونس and we know what we have to do to do and what we have to give as idea and as information and how to structure our response and how to think about safety of the patient, how to ask for help and ask for advice. When we have all this performance, confident come easily, and of course with experience with the interactivity of with the Viva mock and the listen. This confident come in the last.
Perfect. Thank you.
Thank
Dr. Haj, can you share with us your experience? Can you unmute yourself, Dr. Haj?
السلام عليكم إخوة الكرام، اسمحوا لي نتكلم باللغة العربية.
feel free خذ راحتك.
ايوه. والله اقول لكم على التجربه تاعي مع بريميديكو. الاخوه الكرام، حتى دكتور معنا هنا ودكتور اللي معنا هنا عبد الفتاح كان سبق لنا، وان دكتور عبد الفتاح كان سبق لنا وان حضرنا مع بعض، لكن 4 مرات وانا اسقط الامتحان. اقول لكم من 2022 وانا نسقط في الامتحان 4 مرات. دخلت الامتحان حق الهيئه 4 مرات. اضطريت اني اعمل سينيور ريجسترال واحاول كم مره. المره الاخيره دخلت مع بريميديكو، المره الاولى جبت الامتحان، لانه ليه المشكل مش في النولج، والدكتور ايهاب هو معنا وعمل لي تشخيص من اول مره. قال لي كيف سقطت كم مره في الامتحان، وعمل لي تشخيص على النولج. ما كلنا جراحين، كلنا الحمد لله كنا عندنا معلومات ولله الحمد، لكن المشكل كيف تقابل الممتحن، لانه الممتحن يدي عليك نظره من الاول كيس، اذا يعطيك ولا ما يعطيك. من اول كيس يدي عليك نظره، لانه كاين مرضى انا ما كنت نفرق اني نجاوب مريض في العيادات او مريض في الطوارئ. ما كنت فرق، هي فرق انك تجاوب مريض في عياده ولا مريض في الطوارئ. تجاوب جواب اول جواب المريض في العياده تروح مباشره للهيستوري والفيزيكال اكزامينيشن. مريض في الطوارئ لازم تروح لازم الاول تعمل له الستيشن، تعمل له. هذه ما كنت نعلمها بدون بريميديكو، لانه بريميديكو صراحه حاجه نفعتنا كثير. انا قلت لك 4 مرات، وهذا تخيل ديالي 4 مرات ادخل الامتحان. وما هو مشكل في النولج، المشكل دائما اني ما كانت عندي ثقه، حتى لازم تجاوب بثقه، وهذه الثقه تكتسبها من البريميديكو. لذا انا انصح كل المشاركين انهم اذا هم يدخلوا الامتحان بكل ثقه انهم يدخلوا البريميديكو. لانه ليه؟ لانه البريميديكو كل سيشن ولا سيشن وكل قصدي كل شابتر ممكن تعمل فيه ربع امتحانات كل شابتر، لانه انا كل شابتر عندكم 30 حاله ولا 30 حاله، تقسمها على 5 ولا 5 حالات، تفتح لك ربع تخلي معناتها انك دخلت الامتحان مرتين او 3 مرات. فهمتوني ولا ما فهمتوني؟ لانه كل شابتر مثلا دكتور ايهاب او الدكتور محمود عنده حالات معكم، هذيك الحالات تحسبوها انكم عملتوا محاولتين في الامتحان، لانه والله الثقه الشيء المهم في الامتحان الهيئه، انك ثقه، وانك كيف تجاوب، انك كيف تكون مقابل الممتحن. وثاني نصيحه يقولوها لكل الاساتذه الكرام اللي مرينا عليهم، انك دائما تفتح الصوره، بدون صوره دائما تفتح صورتك لازم تبان للممتحن، لازم تبان حتى عندما تكون تدرس، لازم تحل الصوره كما الدكتور خليل وانا نشوف فيه، لازم دائما الصوره مفتوحه، لانه الى هذا هو الامتحان. وإن شاء الله حظ سعيد للكل. وأنا والله دفعت، لكن ما خسارة فيها، حتى لو تكون لي فرصة أخرى أشارك معكم إن شاء الله، وشكرا جزيلا.
Thank you very much.
إن شاء الله.
دكتور حاد. Thank you much for these nice words. As you said, deeply build the self-confidence and how to answer the question extremely important, and this one of our main purpose. And يعني دكتور حاج للشهادة كان very engaged, and in each session when you feel you are in the exam وأمامك examiner, يعني within 6 weeks you will feel absolutely the difference. Dr. Mohammed Abdul Mu'ti, I think he joined us. If you can share with us your experience, he got his exam recently, and
ما شاء الله.
السلام عليكم ورحمة الله وبركاته.
وعليكم السلام ورحمة الله وبركاته.
أولا أنا سعيد إن أنا شفتكم تاني، خصوصا دكتور فيصل، دكتور محمود.
Thank you.
طبعا
واحنا اسعد.
والله انا يعني
لازم نعمل لك
الله والله يا حبيبي وحشتني اكثر والله.
يا دكتور محمد حبيبي تسلم.
الله يعزك يا رب، الله يخليك. طبعا انا يعني يمكن كانت تجربتي قصيره شويه مع البريب ميديكو، مش زي بقيه الشباب ان انا جوينت متاخر شويه، لكن make difference with me يعني a lot. انا دخلت مره ولم اوفق، يمكن الدكتور محمود والدكتور فيصل عندهم التفاصيل بتاعت اول مره. يمكن تاني مره بريب ميديكو ادتني الكونفيدنس، واللي هو عارف فيه حاجز اجتماعي كده وحاجز نفسي دايما بيبقى بينك وبين الاكزامينر. بريب ميديكو دي يعني ساعدتني في الموضوع ده. انا اول موك اكزام حضرته مع الدكتور فيصل، طولنا كتير، لكن بوينتس كلها والله افادتني جدا جدا جدا. خدنا وقت اكتر، وهو والله الراجل مشكورا اداني من وقته ما شاء الله كتير جدا يعني. كان نفسي اعمل موك اكزام مع الدكتور محمود، بس ما حصلش نصيب. هو عارف الاسباب يعني. لكن الوجود في المجموعه زي ما الدكتور رضا قال، وزي ما الدكتور حاد قال قبل كده، وزي ما كلكم عارفين، احنا كل الناس عندها النولج، كل الناس عندها المعلومه بتاعت الجراحه كامله، الابروتش وازاي تكون وازاي تجاوب از كونسلتنت. دي بصراحه الجروب هنا ساعد الناس كتير فيها، وده فرق معايا، لان انا حسيت المره الثانيه ان انا يعني كنت ريلاكس جدا غير المره الاولانيه. انا كنت تنشن جدا، ما اعرفش ليه برضو، اسباب كثيره جدا مش وقتها، لكن المره الثانيه انا كنت ريلاكس جدا جدا. يمكن انا ما حضرتش محاضرات كتير، لكن حضرت موك اكزام كتير مع الجروبز هنا، افادوني فيها جدا جدا. ودي غيرت من الكونسبت بتاع الاجابه بتاعتي، من طريقتي، من حتى طريقه القعده قدام الكاميرا كانت مختلفه تماما عن اول مره. طريقه الاجابه كانت مختلفه تماما عن اول مره. فانا بشكر الجروب فردا الناس اللي انا حضرت معاها والناس اللي انا ما اسعدنيش الحظ ان انا احضر معاها على المجهود اللي عاملينه. وانا يمكن ما حضرتش، هم 3 اسابيع للاسف. انا زنقت الناس معايا والناس مشكورين، بداوا كل واحد يدخل لي على الخاص، احنا عايزين نساعدك، طب قول لنا ازاي، طب كذا طب كذا. وهم اللي بداوا يعرضوا عليا طرق مساعده انا ما كنتش متوقعها بصراحه. لان انا دخلت وكان بيني وبين الامتحان 3 اسابيع بس، فبصراحه مشكورين يعني فوق مستوى اللي انا كنت متوقعه من المجهود اللي عملوه، من ان هم كين قوي ان انا احصل اكتر بنفيتس في الفتره الصغيره دي. لا افادوني فيها جدا، وانا يعني ابريشيت اللي حصل والله جدا جدا، وسعيد جدا بالتعرف على المجموعه، وسعيد جدا بالتفاصيل اللي ادوها لي، واللي كانت بعد الله سبحانه وتعالى سبب ان انا اباس على طول. يمكن انا النتيجه بتاعتي تقريبا ظهرت في نفس اليوم يعني تمام تقريبا يعني. فاللهم لك الحمد. مشكورين الناس كلهم فردا عشان ما انساش حد يعني. وربنا يجزاهم عنا كل خير. الكورس اتفضل
دكتور محمد. what is your advice للfuture candidates regarding the preparation؟ يعني in your experience يعني ايش الامور اللي تنصح بها our colleagues موجودين معنا؟ and even this is recorded webinar ان شاء الله it will be available، يعني ان شاء الله صدقه جاريه، لانه whenever you give check it can be the solution. يعني تتفرج على one of difficult situation for our colleagues.
اوكي، انا كنت لسه هتكلم في النقطه دي دلوقتي. النصيحه ان يعني من اول يوم لاخر يوم ما تحاولش تفكر غير في اللي الدكتور فيصل، الدكتور محمود، الدكتوره هيفا اللي بيقولوا عليه التزم بيه تماما. سيبك من الكونسبت بتاع الاكاديميك باك جراوند، ان انا عايز اجاوب بطريقه اكاديميه اكتر. لا، الكورس بيخليك براكتيكال اكتر. ف الالتزام بالمحاضرات، الالتزام بالموك اكزام اللي ورا كل شابتر، ده هو اساس النجاح. الناس دي بتحطك على الطريق عشان تبقى ريلاكس، مش عشان تحط نفسك تحت ضغط، او ان انا مش عارف اذاكر، او ان انا حتى الناس اللي كان عندها مشكله في اللغه وكانوا بيدرسوا الجراحه بلغه تانية غير الانجليزيه دي، سهلوا عليها الدنيا جدا. والناس دي دخلت ومن اول مره يعني ربنا كرمها من اول مره، ما دخلوش مرتين، دخلوا مره عدوا على طول. فالالتزام بالتعليمات اللي في الجروب بتاع بريب ميديكو دي مفتاح كبير جدا انك تعدي من اول مره، مش هتحتاج انك تخش مرتين، من اول مره. فالنصيحه الالتزام بالتعليمات اللي هيقول عليها الدكتور فيصل، الدكتور محمود، الدكتور ماني، الدكتور باسم، الدكتور، كل الناس اللي موجودين يعني. بس مش محتاج ان انت توسع على نفسك الامور يعني، لا، امور بسيطه. الجروب ديسكشن ده بيسهل الموضوع جدا في الامتحان، بيخليك كونفيدنس، براكتيكال انسر بتكون عندك اكتر، واللي بتعمله في المستشفى كل يوم. بس
يعطيك الصحة دكتور محمد المعطي. Thank you very much for these nice words and for sharing your experience with us. Dr. Ihab, I would like to have your valued expertise in this session. I don't know if still with us. Dr. Ihab? I think there is some issue in the connection. So just two things I will share with you who are our faculty, our schedule for the third session, and then waiting Dr. Wahab to come back. Dr. Mahmoud will do one case. We will need one voluntary, and we will finish with the tips and tricks of Dr. Mahmoud, which are extremely helpful. And personally, I'm learning with him in, whenever we do sessions together. So I will share just my screen. Do you have the presentation here? I don't know. Do you see the picture? Do you see the slide?
Yeah.
Okay. So who are our faculties? So we have Dr. Basim Sharif already introduced himself, and he gave us a very interesting introduction. Dr. Haifa Al-Utaybi, general surgery consultant and surgical oncologist, fellow in breast in UK actually, and she is the writer of the book of study surgery, which we advise all the candidates to have it as one of the most and valuable resource to prepare this exam, because it's a book dedicated for the exam. Dr. Manikandan Katrival, he is FRCS, hepatobiliary surgeon in London. He is the program director of PrepMedico in UK, and also he is our director of PrepMedico Scfhs. Dr. Adel Mahjoub, he is a senior consultant, FRCS, laparoscopic general surgery consultant, and he is ATLS instructor and the program director. There is me and Dr. Mahmoud. We already discussed about Dr. Ihab. I present him already. And we have Dr. Turki Shamari. He's
I'm sorry, Dr. Faisal.
Dr. Ihab. Dr. Ihab,
I'm with you now. I'm sorry. I'm sorry for this. I'm just driving and I have the internet interruption. So sorry. I'm with you now.
Okay. And Dr. Turki Shamari is colorectal surgeon, assistant professor in the MAM University, and also he's examiner. So, Dr. Ihab, what can you tell us about the sessions, our program, how we are running this course?
I'll not add more details than Dr. Basim and the colleagues said. It's a very easy exam to pass, and it's a very hard exam to succeed in it first time. Why these contradicting sentences? Because it's not about the knowledge, it's not about how much experience you are, it's about certain things. Exactly like Dr. Haj and Dr. Muhammad and Dr. Our colleague, like they said, it's all about how you are ready for the exam, how much you are aware about the structure, how much you are safe, when exactly you are going to ask for help. As Dr. Haj said, I believe Dr. Haj is even more knowledgeable than anyone, than myself. So when I faced him, or when I met him in the course, I wondered why you feel full time. And when we started to have our session together, I knew exactly why he didn't pass. It's not about the knowledge. It's about, as I said, it's about the structure, it's about the safety, and it's about being ready. How you are going to be ready to answer a question within a few seconds. The only thing to do this is to be familiar with the question, familiar with the situation. And this is exactly what we are doing in our course. We are putting every one of you with tens of scenarios. Mostly 95% of our scenarios, you will face it in the exam. And as I used to said, in this kind of exam, I have been through a lot of exams everywhere. And I'm telling you, it's very easy to pass the exam, but the most critical point about the exam is that you need to have an appropriate response within few seconds. And I used to said, I took this from Manny himself when we were in FRCS exam. You need to respond from your spinal reflex. If you started to think from your brain, you will take a lot of time, and most probably it will not be the appropriate response. And to do this and to have a response from the spinal reflex, spinal cord, you need to be familiar with the situation. How you are going to be familiar with the situation? with practicing more and more and more. So this exam is very easy to pass it. It's not about the knowledge, it's about the structure, about how much you are safe. As an examiner in this, in the Saudi Commission, I'm not an examiner. I'm telling how they are thinking. They are thinking if they are going to permit someone from outside the country to practice surgery here, they need to be sure that you will be safe. This is the most important thing. It's not about showing your knowledge. It's not about showing your experience. It's about how much you're going to save, because the system in Saudi Arabia, it's all about the patient safety. When you are safe and don't know how to do it, it's much better than when you are not safe and doing something out of your scope. That will hurt the patient here, and that will totally forbidden the system. So most important, they will assess how much you are safe and how much you are familiar with the system. What does it mean, familiar with the system? It's something we are giving in the course. When you are going to ask for help, what's the subspecialty needed to be asked for? What's the system of the Saudi Commission? What's the system of the referral within the hospital? What's the tertiary hospital within the city that you are working in? What the Saudi Commission from the start and how they are dealing with you? What's the license? All of this are open and discussed in our course. The most important thing, and I need to emphasize on this, it's the practice. You need to practice. Even we are giving you a lot of scenarios. Most of our scenarios, we are trying to collect it from the recall exams. That's why you will face, we are covering about, I'm sure about this, from 80 to 85 cases that you are going to face in the exam. Most probably it will be discussed in our course. But more than this, you need to do an extra miles. I'm just strongly recommending every one of you who will join our course, don't be enough with the scenario that we are giving. We'll give you a lot of scenarios, but do a kind of a group together, studying a group, every two of you, and you should assign half an hour or 1 hour every 2 or 3 days to practice with yourself. Practicing is the key success point in passing this exam. It's only 30 minutes. And this 30 minutes, the examiner is looking for specific keywords. These specific keywords, it's not about your experience. It's not about your knowledge. It's about, do you have faced such scenarios before? Did you discuss it before? And from the point of the language, don't be afraid about it. If you started to talk in English with us, it's not an English exam. It's all what's required from your side is to understand what the examiner is said, and he need to understand what you are saying in English. So it's not about the pronunciation, the grammar, just be understandable, and that's all. So I'm welcoming every one of you. I'm taking this chance to congratulate all of our colleagues, and by the way, as Dr. Faisal said, all of our candidates who joined the courses passed it from the first time, even if they didn't pass before. But with our preparation, alhamdulillah, they passed it because we just put them in the right track. We give them the key of success, hoping every one of you to be successful in your coming exam. And it doesn't matter when you are going to have the exam or when you are scheduled to have the exam. We have a very flexible faculty and we have a very eminent faculty. As Dr. Muhammad said, we will try to adjust our schedule as much as we can to fit your date of exam. Wishing all of you the best, and I'm assuring you you will be in a very, very safe hands. I'm myself, I'm benefit a lot from the faculty in the group. Dr. Basim is my, you can say them, my mentor and professors. Dr. Faisal is my colleague and I'm learning from a lot. Dr. Mahmoud Talat and Dr. Mr. Mani and Dr. Haifa. Dr. Haifa is very talented and she will address you the best in the way you will not even hear about it before, in a very smooth way. And by the way, Dr. Haifa, she's a writer of the very famous book preparing everyone from the Saudi result to get in this time. And thank you so much. I'm very sorry for having this internet. So
Thank you, Dr. Ihab. Thank you very much for this very practical advices for our colleagues. So what we can guarantee by the end of the course.
دكتور فيصل إذا سمحت لي قبل أن أغادر المجموعة، والله بودي أشكر كل الأساتذة الأكارم من دكتور ماني إليك أنت حتى اللي جوزت، لأنه حتى كنا نسألوهم خارج وكانوا يجاوبونا، كنا نسألوهم خارج النطاق ويجاوبونا. أشكرهم الشكر الجزيل. شكر ربي يعطيهم الصحة إن شاء الله، وحظ سعيد للبقية إن شاء الله. السلام عليكم. شكرا جزيلا.
عليكم السلام. Thank you very much, Dr. Haj. Thank you. So what we can guarantee by the end of the course, as we said, the key is to have good English, not perfect or excellent, but good English to answer to understand the questions and the case and to be able to answer. Second thing, to develop a standard approach of your knowledges. You have the knowledge, but you need to make them structures and have clear approach for each patient. As Dr. Haj said, difference between patient in the clinic as outpatient or patient in ER or difficult situation, when to call for help, when the summum of all the health system here, what I really admire is the safety of the patient is in the top. And the third thing, the training. And by having a clear engagement from each one of you during the course, you will be able to reach all of that. But you need to be properly engaged. And we are all of us together, we are learning. So by being engaged fully in the course, we believe you will pass all of your exam. So about the program of the third course, in fact, we did a little bit modification because in the end of each course, we take seriously the feedback of our candidates. If there is any elements for improvement, something need to be improved, something need to be changed. And this last update, we changed our program from Friday, Saturday to Tuesday, to Friday, Tuesday. Friday for the lectures, as you can see, except for Dr. Mani and Dr. Haifa, as they are in UK, we were obliged to adapt the system to them. But for the other sessions, mostly the lecture will be on Friday, and Viva will be on Tuesday evening. Why? In the first course, we have just the Viva session once every week. Then in the second course, we introduce lectures as they are doing in PrepMedico FRCS, which is extremely important. And this lecture, it is guided to how to answer during the exam and what are the knowledge mandatory and necessary for your exam. That means this is targeted lectures. So we put them on Friday, Saturday, but it is a little bit closed, and it couldn't give enough time for the candidates to review and prepare for the Viva. So we moved to Friday, Tuesday. That means you will have the lecture on Friday, inshallah, in the afternoon, and the Viva on Tuesday. So I think 2-3 days it will be enough to review the most important thing, to be able and more active on the Vivas. So as you are seeing here, you will start this course by hepatobiliary surgery with Dr. Mani Kandan, then trauma and critical with Dr. Adel, then upper GI with Dr. Ihab, then breast surgery with Dr. Haifa, then general surgery with Dr. Basim, then colorectal lecture and Viva with Dr. Ihab and Dr. Turki, and then we will finish endocrine with me and Dr. Mahmoud Talad. And after each course, by the end, we organize a mock Viva. What is mock Viva? What we call in French, in Algeria, an examen blanc. It is a real life situation exam. 2 sessions it can be one session of 1 hour, because in fact the exam, it is 2 sessions of 30 minutes. So what we did before is one session of 1 hour for every candidate, just questions as a real exam, and then after 15 to 20 minutes of feedback. We will try this course, we will try to do the 2 sessions, 30 minutes. This will depend on our backend team, but we will try to do our best. Add to that, you can visit our website, and you can have more flexibility regarding for someone who wants to pass the exam in prestige date, and he's in hurry, he can book for just mock Viva. Those who have they want to access to our LMS library and Videotech, they can just subscribe for that. Those who are interested for 3 months subscription, there is the 1 year subscription. If you want one-to-one for specific topics, you can book according to your preferred faculty and your preferred chapter. All of that is flexible, and we are open if there is any question or any help that we can give. I will move to Dr. Mahmoud. So I don't know if we have any voluntary to do 1 or 2 cases. If anyone want to be voluntary for the exam, or we can put it open for open discussion. Dr. Mahmoud?
Okay.
If anyone, good afternoon all. If anyone wants to test himself or to be a volunteer having a similar exam that exactly similar to the interview, he can just raise his hand. It is something very voluntary. Or if anyone have a question about the exam, the course, the faculty, we are here to listen to you. After that, I will take 10 minutes to do to tell you some tips and tricks for passing this exam.
I believe that Mahmoud said you can just present one of the cases and the model answer how.
And that is for open discussion.
Yeah. As long as you don't have a volunteer, just all the case and.
Okay. This is the model. Can I take you, Faisal, as a volunteer? We can simulate the exam.
خلاص.
دكتور
محمد علي.
دكتور محمد علي. Welcome, Dr. Muhammad. How are you?
الله يخليك. الله خير.
Dr. Muhammad, would you please introduce yourself?
أنا دكتور محمد أبو البشر محجوب علي من السودان. امتحاني إن شاء الله on 13th of September, and I joined the first course. Me and Dr. Muhammad Taifour, we joined together the first course قبل فترة. قلنا بس as a step عشان نبدأ من وين نبدأ وكده. إن شاء الله الامتحان after 2 weeks. We passed.
You already, Dr. Muhammad, you already joined the first course.
The first course, yes. We are the first batch, yes.
So I assume you have some knowledge, or I can say you have enough knowledge to pass this exam, and this will be extremely important for our visitors here and attendees. Dr. Muhammad, you are now being evaluated for a consultant exam to take Saudi license to practice surgery, general surgery in Saudi Arabia as a consultant. For this, we are going to go through a couple of questions. I can start now with case number 1, Dr. Muhammad. You have a 41-year-old male patient presented to the ER by right upper abdominal pain and vomiting for 3 days duration. What will you do for him, Dr. Muhammad?
First of all, I will go through the ATLS protocol, A, B, C, D, and E. I will go and check for the airway. If airway is clear, we're putting the cervical collar, then oxygen supply, and after that, the breathing.
Excuse me, did you hear me? He is not in RTA. He presented by right upper abdominal pain and vomiting, fever for 3 days duration.
Okay, I'll go through detailed history. I'll introduce myself first, and then I will go through and I will make sure the patient is fully prepared, and assessed and resuscitated in the ER. And then I will go through the complete history and physical examination. In the history, I'm going to analyze the pain, the site of the pain, the onset of the pain, the character, associated symptoms, any aggravating or relieving factor, and the
Thank you, Dr. Muhammad. So we will start by resuscitation of the patient, then detailed history. The history will say he's a 41-year-old male patient presented with right upper abdominal pain radiating the right shoulder, with vomiting for the last 2 days and the fever for the last 5 days, and now fever is 38 degrees. He had past history of similar attacks along over the last year, especially related to fatty meal. Patient laboratory, patient otherwise history, he is diabetic, he is on insulin, he otherwise no medical or surgical relevant data. Laboratory investigation, the relevant part is white BCs was 16,000. What will you do for him next after resuscitation and taking this history?
total white blood cells is 16.
16,000.
Yeah, okay, and I'll
also his LFTs are elevated. To create the lab data for him, his LFTs are elevated in the picture of liver enzymes and total and direct bilirubin.
Okay. This patient, most probably he has a gallstone disease, may be complicated by CBD stone, and he has cholangitis. So I will admit the patient, give him MBO, I'll give him resuscitation form.
First in ER, what will you do to confirm your provisional diagnosis?
First of all, I will do, after the blood investigation, I'll do the ultrasound to see the features of the gallbladder, the wall of the...
The finding of ultrasound. Ultrasound showed dilated common bile duct, about it is 8 millimeter in diameter with distal obstruction, and dilated also intrahepatic and extrahepatic biliary radical. What will you do next?
Next, I will book the patient for ERCP for drainage.
What's your diagnosis now?
Now this is ascending cholangitis due to CBD stone.
Okay, your patient now is in ER. He is lying on a bed in ER. What will you do for the next step?
In the ER, I will admit the patient. I will process for admission of the patient, urgent admission of the patient, keep him MBO, NG tube, catheterization, input-output chart, and vital monitoring, and I will admit the patient to the ICU. And then I will consult the gastroenterology for urgent ERCP for drainage.
So this patient, you say he needs ERCP for drainage or decompression of common bile duct as a treatment or a management of acute cholangitis. But you have now an issue. The ERCP physician is not available in your hospital. You are in a peripheral hospital, and the next hospital is about 8 hours away from you. What will you do?
I will put the patient on conservative management, but if there is inaccessibility for PTD, percutaneous transhepatic drainage, I will go for it. If not,
IR is not available on your hospital.
I will call for a senior consultant if it's available, and if it's not, this patient for urgent drainage procedure, surgical drainage.
So what will you do exactly?
This patient for cholecystectomy with a T-tube insertion.
Cholecystectomy?
And CBD exploration with T-tube insertion.
Okay, thank you, Dr. Muhammad. I finished this case. For all the viewers here and the candidates, our future candidates, inshallah.
If you permit, I have one case, second case of trauma. If you permit, then You can follow with the tips and tricks.
On Dr. Muhammad's answer, and you go on, no problem.
Yeah, okay, okay.
Overall, I will not take too much. I will, as you say, or as you said, as you see, or I examined Dr. Muhammad. I asked him for one case, and he, in me and as an examiner, I think he answered the model answer. For me, he will pass this exam according to his answer in this question. Thank you, Dr. Muhammad.
Thank you.
If you allow me, Dr. Mahmoud, but I have a few comments, Dr. Muhammad.
تفضل تفضل.
So Muhammad, it's quite obvious that you are very experienced and very knowledgeable. But the tricky point in your start, you started very quickly.
معلش الصوت قطع شوية صراحة.
You started very quickly, and your start was absolutely wrong. Why? It's not because your knowledge, but because you didn't listen to the scenario carefully. And this is one of the red flag points that might push you in a very bad pathway. So what you need to do, just to listen very carefully to the scenario, then think about it for 5 seconds. Because if you started like you started with Dr. Mahmoud, you will lose the mark. You will totally lose the mark. Okay? This is the first part. The second part, so it's very important to all candidates. It's very, very important to listen carefully to the scenario. And if you didn't understand anything, for the people who cannot understand English properly, it's not shame at all to ask the examiner to repeat it again, or to ask him what exactly you mean by this sentence or by this word before starting answering. Okay? Apart from this, you were so great, you were so perfect, and you passed the scenario with Dr. Mahmoud very perfectly. But they like to hear a lot of sentences, a few sentences, especially in the ER. Whenever you are called about a case in ER, you need to say, I see to assess the patient myself in ER. That means that you will be a keen consultant. Then, if the patient comes with abdominal pain, you will say, I need to make sure that the patient has been resuscitated and manage it as per CRESP protocol. CRESP protocol, it's the same like ATLS protocol for trauma. It's the same ABC. I believe all of you know about CRESP protocol, and if not, we'll explain it in our course very precisely and very in detail. Then you will start managing as exactly you pass the case with Dr. Mahmoud. So your performance was perfect, but you need to calm down and practice more and listen carefully. Thank you so much, Dr. Mahmoud.
Okay. Thank you.
Thank you.
So, who want to go next? Dr. Muhammad Taifour. And also we have Dr. Abdel Fattah Dibani. So I will take Dr. Muhammad Taifour and Dr. Abdel Fattah will be before Dr. Mahmoud Talat. Okay.
Dr. Mahmoud, I want to ask one question for Dr. Mahmoud.
Okay.
Is there any rule for MRCP? You didn't ask about MRCP for this case.
Dr. Abdel Fattah, if you ask it for MRCP for this patient, you will fail. If you ask it only. No rule for MRCP in this patient. This is the trick. This is a very important trick. Okay, this is يعني مبدئيا this is a very important question you ask. This is a very and some of one tricks that make you pass or not passing this exam. So I will give it its time. As Dr. Ihab said, if any patient came in a critical situation, we will not talk about other patients. We're talking about this case. We have RTA, this is critical, non-critical, but we have a critically ill patient, surgical patient. As Dr. Ihab said, CRESP. It is critically ill surgical patient, not traumatic patient, but is critically ill surgical patient. This, I mean, a disease, critical ill disease. For example, this case, he has abdominal pain, he has fever, he has vomiting, he has for 5 days. So we should start by resuscitation. This is the first thing, ABC protocol. And then we will do the minimal investigation that make us to diagnose. Then start the management urgent. MRCP will take long time. This is a very valuable time for this patient and will not add anything for the diagnosis and for the management. Why you will do MRCP? What will you find in MRCP? Discuss with me. What will you find in MRCP? What do you expect to find in MRCP?
And ultrasound is not perfect in diagnosis of stones in CVD, but MRCP more accurate. Also pancreatitis sometimes maybe at the same time diagnosed at the same time.
I am with you if ultrasound was negative, but ultrasound clearly said there is dilatation in common bile duct. There is obstruction, and also you have the diagnosis of a disease, as we all know, is not only one information. It is a complete picture. We have patient with fever, abdominal pain, previous history of recurrent attacks of similar attack. He has high or elevated liver function test, especially bilirubin, and the ultrasound confirmed what we suspect. We put a provisional diagnosis, and we suspected obstruction and biliary obstruction. For example, common bile duct obstruction. After that, we did ultrasound to confirm, only to confirm, not to diagnose. So we diagnosed after the ultrasound or confirmed diagnosis of acute cholangitis. This is a critical situation. He is a critically ill patient. We should do something urgently. What we should do is the decompression. Decompression can be done, as we said, by ARCP, intervention radiology, or even surgically. If the cause of obstruction was a stone, was a tumor in common bile duct, was tumor in pancreas, it will not add anything for the management. Anyhow, we'll do compression. So MRCP will waste time for us and for the patient, and will not add anything for the management. I know we should do MRCP later on to diagnose the patient well, but MRCP is not indicated, or even it is contraindicated in this case as acute case.
And Mahmoud, if you permit, tell me which hospital can do MRCP 24 hours by 7. It's not.
Yes,
it's not very available. And second thing, if the ultrasound will give you the feature of CBD stone, there is a feature of cholangitis with the inflamed wall, dilated CBD with feature of stone in the distal CBD. You can go on, because this life-threatening situation. This is the idea. Decompression, endoscopic, percutaneous, or surgical.
Oh, go on, Dr. Faisal, sorry.
Yeah. The most important thing. Yes.
If you want to go to say something, because I have something to say.
Okay. It's okay. Go on. It's okay.
Okay. Dr. Al-Fattah, I know you are Egyptian and worked in Egypt, and also I worked in Egypt. I was minded like this before I came, or I get prepared for this exam. I will give you another example, will make the picture more clear. If you have a patient came in RTA with chest trauma, and this patient with suspected pneumothorax, what will you do first? X-ray or decompression, for example, chest tube or
needle decompression, Start with needle decompression and prepare for.
Are you sure 100% of the diagnosis by clinical only? Or you need to do X-ray, chest X-ray?
Chest X-ray will waste time in distressed patient.
Exactly what you said. It will waste time. Oh, yes, it will make me sure 100%. But after the patient die.
Yes.
The patient will die and I will be sure. This is not the aim of our job here. The aim is to save the patient, and okay, no problem, we will be sure later on. But the aim is to save the patient. If you put a drain, a chest drain, and he's not a pneumothorax, no problem. But you are about you saved 100 patients and put one negative, for example. It will not be negative. But if you put one negative and saved 100 patient, it will be right decision. So this is the exact example as in the critically ill patient. You first manage by the minimum investigation and work up for diagnosis. So manage them. Don't wait for MRCP. MRCP will waste time, will waste a very valuable time for the patient. He is in a septic shock. This patient is in a septicemia at least, then will be septic shock and later on multi-organ failure, irreversible stage. You will not be able to save this patient, especially if he is a weak patient with multiple comorbidities. Besides the knowledge, this is the skills, what we are saying. They like this in the exam. If you did this in your life, the patient may pass, no problem, will pass successfully, but you will not pass in the exam if you said this. This is the skills of the exam. That's why I will say in the tricks, we are giving you not only the knowledge, we are giving you also the skills of the exam. We are giving you the knowledge to be a good doctor, no problem. You have many knowledge, you have very big knowledge, but what we have here, very, very valuable thing here is the skills to pass the exam. This is one of the skills. So that's why I asked this question especially.
Okay.
Okay, we will go through a short case with Dr. Mohammed Taifour, and we will conclude, inshallah. So, Dr. Mohammed, are you ready?
Yes,
You
I'm
have,
ready. Yes.
you have 25-year-old male patient brought to the emergency department by the EMS due to road traffic accident. How will you approach this patient?
Okay, I will go myself to the ER and assess the patient according to the ATLS protocol. First, I will make sure his airway is patent. I will speak to the patient. If he's speaking freely, it means I clear his airway. I will put a cervical collar, and I will connect him to 5 liters of oxygen by nasal cannula. Then I will go to assess his breathing, and I will examine his chest, his trachea. I will percuss the chest, and if this breathing is clear, then I will go to the circulation. I will insert 2 wide bore cannula. I would draw blood for investigation, and I would assess his blood pressure and oxygen saturation, and I will make sure that there is no external bleeding, and I will connect him to 1 liter of crystalloids bolus, and I would ask for blood to be prepared, and then I will go for examining his disabilities and his Glasgow Coma scale, and then I would ask for adjuncts to the primary survey, chest X-ray, pelvic X-ray, fast scan, and then I would expose the patient fully, and then I would yes.
Regarding the airway, the patient was lethargic but conscious, talked freely, and C-collar was applied. Regarding breathing, oxygen via nasal cannula, saturation 94%. Blood pressure 87/56, and tachycardic 132. So 2 large cannulas was inserted, blue drawn for investigation, and we started already fluid and blood resuscitation. The fast scan is positive, and examination of the abdomen is slightly distended and tender, especially in the left side. The GCS 14/15, known signs of lateralization, chest X-ray and pelvic X-ray, unremarkable, and follicators bring clear urine. You take your ample history, and the patient is not allergic, not regular medication, no past medical or surgical history. He didn't take any meal since 4 hours, and the vehicle didn't roll over, but it was direct help from the left side. What will you do next?
Okay, I would assess him again after taking the bolus of crystalloid. If he's
still hypotensive.
Still hypotensive.
Yes, I would after fluid and the blood is still hypotensive.
Okay, this patient is hemodynamically unstable, so I would take him immediately to the OR for exploratory laparoscopy.
Perfect. So you take this patient in OR. How will you manage intraoperatively? What will you do?
Okay, After draping and prepping, I will drape the patient from the chin to the knees, and I will drape him. Then time out, and I would before incising the abdomen, I would alert my anesthesia team to be ready to resuscitate this patient after opening the abdomen. I would do a midline laparotomy from the xiphoid process to the pubis, and then I would, upon entering the abdomen, I would do suctioning of the whole blood and 4-quadrant packing.
Okay, you did all of that, and finally you found the ruptured spleen. How will you manage?
Okay, I would go straight forward for the splenic hilum. Okay, after resuscitating the patient, I would clamp the hilum of the spleen, making sure not to injure the tail of the pancreas and the colon or the surrounding structures.
What will you do with this ruptured spleen?
I would go straight forward for splenectomy.
Okay, you will do emergency splenectomy with or without drainage?
No, with drainage.
Okay, what are the things that you need to be careful during your splenectomy? And what will be your next step perioperatively?
Okay. Yes, I would make sure not to injure any of the surrounding organs, especially the tail of the pancreas and the splenic flexure of the colon and the diaphragm and the stomach.
You did your splenectomy. What will be the next step?
Before
before closing the patient.
I would do formal laparotomy to exclude any other injuries in the abdomen.
So thorough exploration of all the organs. Okay. A few days later, you observe that there is a persistent leak from the drain. What will you do?
I would draw a sample from the drain for lab investigation, looking for the amylase and lipase, and I would do also serum lipase. Then I would check if there is.
What is the ratio that you will you use to diagnose?
If 3 or more.
Okay. And
triple
what is diagnosis?
This is pancreatic fistula, most likely.
Okay. So you are diagnosing these patients as pancreatic fistula. How will you manage this patient?
I would start with the conservative management. I would reassess the patient. I would make sure that the patient is resuscitated well, and then I would start the octreotide, and I would ask my gastroenterology colleague for ERCP and stenting of the pancreatic duct. And then I would follow the drain output and the general condition of the patient. If he is responding, I would continue on the same conservative management. Otherwise, I would consult
so it has a good follow-up. How will you manage before discharge the patient on discharge?
Sorry, I couldn't hear the question.
Your patient improved and you plan to discharge him after 10 days from the accident. What is the precaution to take on discharge?
Okay. If the fistula is responding well and it's closing right now, then I would make sure before the discharge, the patient would take his vaccination against encapsulated organisms.
Okay. Thank you. Thank you, Dr. Mohammed. So welcome. Just few commands. There is some rule that I'm giving for our friends and colleagues. The exam is 2 sessions of 30 minutes. And in each session, you will have between 4 to 6 and sometimes 2 cases, sometimes 2 long cases. But the average is between 4 to 6. So if you have, imagine 6 cases, in each case, you will have 5 questions. That means you have 30 questions within 30 minutes. That means you will have 1 minute or less to answer. Very important to have what Dr. Ihab said very clearly, the spinal cord, the reflex answer. when we ask a question, everything need to be very clear, as Dr. Mohammed did. ATLS protocol, A, B, C, D, E, adjunct. Then what's next? What's next? You will expect the question and you have the answer. This is medicine, no extraordinary or something else. If everything is written, everything is clear. So you have to have as a reflex, control the time, because the examiner, when he feel you are running away from the answer, he will have the feeling you are not confident and you don't know the answer, which is very, very important. And always some reflex. For example, I would like to manage my patient conservatively, so I will keep him MPO, I will give IV fluid, I will give antibiotic, I need to follow my wound, very important. You have pancreatic fistula and it can get for another complications. The ectreotide, after 7 days, we need to consider the total parenteral nutrition or nasovaginal tube nutrition, extremely important. If the patient not improved and still the fistula is still bringing, we need to consider endoscopic treatment with our colleagues, interventional endoscopists, with sphincterotomy plus or minus stenting, pancreatic duct stenting, which is very important. Most of these cases will be managed successfully medically and endoscopically. Rare to go for surgical treatment. So thank you, Dr. Mohammed.
Allow me, Dr. Faisal. Dr. Faisal, if you allow me.
Yes, Dr. Ihab, yes, sure.
Dr. Mohammed, you did a great. You went through the scenario perfectly. بس في شوية حاجة كده. First of all, it's a short case, and whenever you have a short case, you need to be smart, because the examiner have at least 14 questions to be answered. So nobody is going to listen to ATLS protocol from from A to E very precisely and very in details. So whenever you have this announcement that it will be a short case, you need to go through it smartly, like this. I'll go myself to the ER and assess the patient myself, making sure that the patient has been resuscitated and assessed as per ATLS protocol from A to E. وبعد كده تسكت تاخد يعني take a pause, which is giving a chance to the examiner if he's going need to listen to the details or not.
Absolutely.
Dr. Ihab, you are taking the tricks and tips for me. Very nice tricks and tips.
Yes.
الحقيقة يعني in fact this exam has a big amount of tips and tricks, in fact, and I think it is a cornerstone for passing. We cannot cover it in one session, unfortunately. We hope to, but inshallah يعني will be discussed repeatedly in the course. Connection of Dr. Ihab, I think it is some interruption, has some interruption.
Exactly, yes, as you said. I'll go to airway and breathing and circulation. Be smart in this. سامعني دلوقتي؟ الو؟
Yes. No.
ايوه كده مسموع كده.
Yes.
طيب ممتاز. انا I believe Dr. Mahmoud will say in about 10 minutes it will be very fruitful and advise all of you to listen to it. بس انا I'm trying to give a live feedback عن case scenario دكتور، لان انا I believe Dr. Mohammed will get into the exam next month يعني. فهو is doing great، بس احنا محتاجين بس الفاين تاتش. الحاجه الثانيه don't forget في حالات التروما البلد والترانكزيميك اسيد. عيان بليدنج لازم ياخد ترانكزيميك اسيد، لازم، ولازم تبقى جاهز بالبلد. الحاجه الثالثه انت في العمليات you don't have to tell in details but you need to highlight it. I'll follow the MOH checklist of sign in, sign out, making a line with anesthesia, making a line in the blood bank. All of this need to be mentioned. In trauma laparotomy, it's perfectly as you said, packing, then searching for the bleeding, then managing the bleeding. But after packing, you need to say it like this. After packing, I'll align with the anesthesia. If the patient is stable or not, if the patient, the anesthesia need to give blood, you pack the patient and you solve the problem of the acute bleeding. Then completion of the scenario, you went, as I said, it was perfect, but I'm trying to make it more perfect to get the full mark. In completion, drainage, yes, but what if you have a kind of biliary complication? Now you need to involve the hepatobiliary surgeon. Now you need to say this. I'll consult the hepatobiliary surgeon in my hospital. At that time, he will not knew exactly that you are totally safe.
الصوت يا دكتور إيهاب مش حلو.
He will continue the scenario with you. As exactly said, it's about the drainage, about amount of the drainage will be decided at the end. You might need the drainage model. يعني
دكتور إيهاب الصوت مش واصل كويس.
I think there is a connection issue with Dr. Ihab. Dr. Mahmoud, can you continue? دكتور محمود
معاك يا دكتور. دكتور إيهاب الحقيقة الصوت.
So I think you can continue with the tips and tricks, and you can conclude the session.
He's stealing a very valuable information. He really is stealing a very. I quote some of what he say. He's stealing a very valuable.
Thanks so much, Ruben. Dr. Muhammad, you will pass it very smoothly, inshallah.
Inshallah. Thank you, Dr. Ihab. Thank you.
طيب. Okay, I know everyone is tired now. We took a long time, but I promise you of two things. The first thing, I will be as short as possible and as fast as possible. And the second thing, I will be very valuable and very important talk now will be very helpful in passing your exam. First, I want to ask you, and it will be some sort of interactive. I want to ask one question. It is a general question. If you want to pass a test on your life, in your life, or pass an obstacle in your life, to be more general, obstacle in your life, or especially a test in your career or in your learning process, what do you want first thing? If you want to pass any test, what do you want first thing?
How to plan? Yes. How to plan or
plan? Yes, this is the word I want to hear. Plan. You should put a plan. If you want to do anything, if you want to buy a car, if you want to buy a house, if you want to get married, you have to have a plan in your mind to do this as a right thing. We are all surgeons. We know that if you are going to do a surgery, especially if it is a difficult surgery, we have to take few minutes or even few hours or even few days before the surgery to put a plan. What I will do, I have a patient with calcular cholecystitis, and this patient had previous history of umbilical hernia with mesh. That patient need a plan different from the patient without a mesh, with hernia. How I will open, how I will go through the peritoneal cavity, not to injure the bowel, not to do like this. So we have to put a plan. This is a test of the plan. This interview is an interview for the plan. You need to have a plan to pass this interview. And this is our job here, to put a plan. This plan, to make it easier, has a role of 3. This plan has a role of 3. This is a very interesting talk. You will meet 3 persons in the exam. They will test 3 skills. That's why we will give you 3 tools. The 3 persons you will meet, one is an administrative person. He will not evaluate you as an exam, but he is important person to prepare the setup for the exam, to make you comfortable. He will not ask you any, of course, if no questions, no medical question, but he will prepare or check the preparation of the setup of the exam. So we will tell you how to do the setup of the exam to be comfortable in the exam. Second person and third person, you will meet two examiners. You will meet two examiners. One will ask you few short questions from 6 to 8, even to 10 short questions. And the other examiner will ask you a long questions, 2 or maximum 3 questions. The examiners or the persons will test 3 skills. They will test first thing your knowledge, the information, the knowledge, the general surgery. We all know most of them. I know you are all consultant and know most of them. And also will test your approach as a consultant. You can be a resident and know how to treat appendectomy. You can be a specialist and know how to treat appendectomy. But if you are a consultant, you have an approach to treat appendectomy or appendicitis or some disease. This is the approach he is testing it. We are not talking about easy or simple cases. We are talking about mysterious and some extent obvious cases. Patient has abdominal pain. What will you do for him? It carries many differential diagnoses. So what is your approach as a consultant to reach the diagnosis and not to miss this patient? He will test this. Last thing of the skills, as we are going to the rule of 3, he will test your stability in working under stress. Dr. Khalil, I see you very attending and very interested. Can I ask you a question?
Yeah, you can.
If you are in a surgery and you found bleeding, you know what to do?
In intra-abdominal laparotomy or any bleeding?
Any bleeding. I'm talking generally. You have bleeding.
Yeah.
And you want to stop the bleeding. You have steps to stop the bleeding. You know the steps.
Yeah.
Of course, you are a surgeon. You know, you do compression, you do ligation, you do cautery, you do, you put Surgicel, you put like this, you give blood, you do such and such.
Yes.
Here we are sitting, we are comfortable, we are having our cup of tea, we are after Jum'ah prayer, we took our breakfast, we are calm, we can do what we know. We will do what we know. But stability means you will do what you know when you are under stress. This is a very important skill he will examine. He will put you in a very stressful situation. In the exam, not stressful case. It is a stressful situation, and I will tell you how. And he will test what will you do in this stressful situation. You already know that the patient was bleeding, you will do compression. You know this already, you know it. But will you remember it in the stressful situation? This is what is he testing. So how will you test this? He tests this. He will ask you a question, and when you answer, he will tell you, no, you are wrong. He will be, as we say, in your face. He will tell, he will ask you, really, are you sure? Are you sure? He will bully you, I mean. Are you sure of your answer? So you will get stressed, very stressed. He is an examiner, he is angry, he will fail me, so I will be stressed. He will put you in a very stressful situation. Then he will ask you a question. He will tell you, Khalil, are you sure of what we are saying? Are you sure of that? Are you sure of this management? So tell me, what will you do such and such? Now you are very stressed. You are feeling that like I will pass, I will fail, I will lose my license, I will lose my money, I will lose my privilege. So you are stressed now. What will you do? You will be stressed. Will you answer the question you know already under this stress or not? This is he is testing. So this skill is very important. Last thing of the rule of 3, we will give you 3 tools to pass the 3 skills from the 3 persons you will meet. You will give you the informations. It is already, I think you have many of them, but we will circulate all the information you need. We will give you a very important tool, which is training. I mean simulation of the exam, simulating the exam, will train you, will put you in sessions many times before the exam. In the exam, you will have 2 sessions. In our course, we'll take around 20 sessions, just like the exam. So when you go to the exam, you will feel yourself as I am in a usual training. I'm now training, I'm not examining, I'm in a training. I did the training well. And the last tool that we will give you is evaluation and feedback of your level, of your way to أداء. I mean أداء. What mean أداء? What's meant by أداء? Someone help me in English.
Performance.
Performance. Thank you. We'll give you an evaluation and feedback about your performance, so you can improve it. You don't need to improve it inside the exam. You need to improve it outside the exam. This is a general tips and tricks for the exam. As we said, plan, content of rule of 3, 3 persons, 3 skills, and 3 tools will give you to pass the exam. And very good luck for you all.
Thank you very much, Dr. Mahmoud. Thank you very much. So we achieved the end of our session, and we would like to have your questions. If there is anything unclear, if there is any question, any query that we can help. Dr. Mahmoud Taifour, please.
My question is how to know the short cases session from the long cases. Will he tell me that this is? Hello?
Can I answer?
Yes, Dr. Mahmoud. Yes, please.
Okay. Anyway, Dr. Muhammad, you don't need to know what the short or the long session. Most probably you will start by the short, most probably, but you don't need to know. You already have the skills for both, but you have to be oriented. You have to be oriented to answer. Type. If you want to know the short question, the session with short question, it is like a ping pong game. He will ask you a very short question and a very clear diagnosis before starting. For example, he will tell you, you have a 35 female patient came into your outpatient clinic complaining of neck lump for 1 month duration. Now it is clear. Can you say one word about this question? What is this? What will be this disease? Open the mic. Open your mic.
Dr. Taifour, can you open the mic? I'm not hearing you.
Yes, this is most likely a thyroid.
Exactly. You already know the diagnosis from the first word of the question. So he will ask you, what will you do? You will say, I will start by assisting by history, general examination, and investigation. What will you do? I told you the history and I told you the examination. What will you do? You will say, I will do a thyroid function test and ultrasound. So a thyroid function test was normal. Ultrasound shows thyroid nodule in the right lobe and another nodule in the left lobe with Birat classification 4. What will you do? You will say, I will do FNA. FNA showed papillary lesion or papillary neoplasia. What will you do? I will do tonothyroidectomy. Stop. This is the short question. This is a short session. Will be like this. I will tell you how will be the long session. He will tell you, Dr. Taifour, you have a 55 female patient admitted in ICU because of a chest infection. She is being treated as a chest case, and the medical team called you to see the patient that she has abdominal pain. What will you do? Do you know the diagnosis of this patient?
This is vast.
This is an open question. This is an open case. In this case, mostly this case will be the long case. But for example, he may mix the sessions. One can ask, because they does not stick to a rule. In fact, he may ask you a short question, then a long one, and the other session will ask you a long question, then a short one. So you have to know to have the experience or the skill only. No need to know which is the session. No need to know which is the short and the long. You have to have the skill only and answer as the question come to you. In this question with abdominal pain, he is asking about your approach. You have a patient with abdominal pain. I will stop like this and know what to do, or I will start systematic thinking and start by history, clinical examination, then investigation. and something will be found at the last. You will find something. Of course, if this is an exam, he's asking about a case. He's not pretending. It is a real case. So you will find no problem. You don't need to know the short or the long question. As I said, you have only to need you need to have the skill only.
Absolutely agree. And also, for example, for the case of trauma that we did, I put you in hurry, question by question, very fast. I didn't give you enough time. What will you do intraoperatively? You gave the key. I pass for the next step. What will you do? You start to give the details of surgery. I ask you, so which type of surgery? You told me splenectomy. This is what I want to hear. And what else? So I will put a little bit of pressure and question, answer. In the long case, you will feel that the examiner want to hear more and more and more. So since the start, first, second question, you will know his orientation. Is it a short case or long case? But the most important, you need to answer as bystander. The most important things are the details. To be sure that you get the point. Any other question from our colleagues today? If you have any other questions regarding the exam, regarding the course, everything is clear. I think we make them tired, Dr. Mahmoud.
Yes.
دكتور فيصل، دكتور محمود، هل في اي فيدباك من ال previous candidates في اي odd question، اي كيس ما كانت متعودين عليها، في new case something new؟
There is some updated question, and for this reason we are following every exam to enrich our library and cases. And usually it is through one or two new questions. Yani standard case, but they will bring one or new questions. And this is what we are trying to do through the sessions, long and further details. And one of the most important things in the lectures is to have more details for every topic. For example, when we talk about thyroid cancer as lecture, you will have all the possibility, all the type of cancers, all the types of the follow-up, how to manage, how to deal with that. You will have global knowledge. But when you come to the Viva, you will go through the case, but you have the other possibilities. And we are, our cases are based almost more than 90% from the recalls, and they are updated regularly.
In fact, Dr. Muhammad Ali is who is the asking. Right? Dr. Muhammad, as Dr. Faisal said, this course is 6 weeks course with 12 lectures, beside the mocks and the simulation. So we almost cover all the curriculum and the questions. But if there is one or two questions, in fact, in any exam, you don't need to answer 100% of the questions to pass. You need to answer 75, 80, and you already have 90 or more than 90%. And if one question came outside the curriculum and outside the lectures, it will be accepted if you do not answer it. And it will be good of you if you said, I don't know, I'm not familiar with this case. But it should be not an urgent case, of course. It could be, for example, my exam, my own exam was like this. He asked me many questions. Then he asked me one, are you familiar with laparoscopic hernia repair? He is talking about TAP. I told him, no, I'm not familiar. Because I can do it, but I'm not professional in it. I told him, no, I'm not familiar with this. He accepted this very well and went to the second question, and I passed in this exam. You don't need to be familiar with 100% of the questions.
Yes, absolutely.
If you answered 90 or 80 or even 75% of questions perfectly, as they like and as we say, you will pass this exam.
And the most important, be safe. Make sure you are working in a team. and be safe. You are not alone, because the health system here make the life easy. You have always the head of department, senior consultant, call for help, call the ministry, refer the patient. So the most important thing, be safe with your patient and save him. This is extremely important.
Thank you.
Welcome.
السلام عليكم. كان عندي سؤال بس.
شور.
انا لسه مخلص امتحان SR بقالي اسبوعين. شايفين 6 أسابيع كفايه ان انا اخش امتحان كونسلتنت كبريبريشن؟
دكتور عبد الله ماهر from Egypt.
Yes.
We have one experience from Dr. Bakir from Algeria. He was one of our first candidates. And as you know, we study the medicine in Algeria in French, not in English. So imagine he came in Saudi Arabia, change of all the condition, new work, new job, change of everything. And when he came, he has the exam after 6 weeks.
Yes.
Yani a French background, a lot of modifications in his life, and with a lot of pressure. So he attended, he was very, very serious, and he got his exam, and he passed his exam since the first attempt.
MashaAllah.
Yes,
MashaAllah.
6 weeks.
يعني you have the advantage already. Your studies you did them in English, and you passed. Alhamdulillah, مبروك عليك the exam, Professor. So you have updated you have updated knowledge, which is very important. معناه راح تخش directly في السيركل تاع training, update in the lecture and training in the vivas, prepare the exam, and 6 weeks. I think with good preparation it will be enough.
Yes. 6 weeks, I think it is a very enough or more than enough period. I have one candidate, Faisal, I think you don't know him. He passed the exam in 3 weeks only. He came and started from the zero, as we said, from the ground. He was not knowing from where to start. And in 3 weeks, he examined and passed. So 6 weeks are very satisfactory time, but you have to work hard. You have to take it seriously and work hard, and you will pass in 6 weeks.
أنا بالعكس I think take profit لأنه عندك knowledge still fresh.
Exactly.
من الإكزام تاع senior registrar. I think take profit لأنه الأمور fresh وستيل يعني فيه الفولنتري وفيه الفورس انك تريد instead انك ترجع للزيرو تعاود تبدا من الزيرو. It will be a little bit difficult. Continue in the same level. I think it will be better.
Yes, exactly.
Yes. Thank you. جزاكم الله خير.
Welcome. Any other question from our friends? So we arrive to the end. Thank you very much, our colleagues. Hope, inshallah, we achieve our purpose to make things clear for the exam, for the system, for the simulation of the case, the tips and tricks. Dr. Mahmoud Talat, thank you very much for your tips and tricks. Dr. Bassem, Dr. Ihab, for your valuable comments and supporting this session. Thank you very much for all our previous candidates who gave and shared with us their experience. If you need anything, if you have any question, feel free to ask on the group. You have the link in our website to subscribe in the main group, PrepMedico Scfhs. So you can ask any question, whatever we can do for you to help or answer or guide. You are the most welcome. If you want to subscribe, you are the most welcome. We will start our third session, inshallah, next Friday with Dr. Manikan. Then unfortunately he's in OR. He would be very happy to be with us today, but inshallah you will have the opportunity to attend his valuable lecture and vivas for next week, inshallah. And thank you very much again. Thank you. السلام عليكم.
السلام عليكم.
عليكم السلام.
وعليكم السلام ورحمة الله وبركاته.